one of my research interests has also been on improving our ability to predict type 1 diabetes development. This is an important question because it is hard to predict who's going to get diabetes and who is not. We do have tools, which are autoantibodies, that we use to screen relatives of patients for the presence of these antibodies. And if they have them, they have an increased risk of developing disease. However, there are many caveats to that, and usually we can say that people that have more than one antibody have a higher chance, much higher chance of developing diabetes over a period of time, but we have very little information about the timing of that process. And that would be important because as we're trying to do trials to intervene early in the disease process, perhaps to prevent development, it would be important to be able to identify those that are going to progress faster because they might be requiring perhaps a different type of therapy than those that might be earlier in the disease course. And also it helps us in doing trials that are more efficient in terms of number of patients that we enroll, the follow-up that we need to do, and so forth. So one of the projects that I've been developing over the past few years has been to look at microRNAs in the circulation as potentially biomarkers of type 1 diabetes development. And these microRNAs are just small RNA molecules that are very important because they actually regulate essentially every biological process. And they usually live in a cell, but they are released in the circulation, which is essentially the sewer of the body. So whatever it's in there is telling us what's happening in the body. So we've been measuring these microRNAs in a cohort of at-risk children from the type 1 diabetes TriNet. And what we found is that we identified a group of microRNAs that are elevated. And those microRNAs, when they're elevated, they're associated with much greater risk of progression. Above that is conferred by the presence of autoantibodies. So that is usually something that has not been observed with other type of markers. So I'm actually excited by this finding. It's been published in Diabetologia in August 2017. And of course, we're planning on follow-up studies because when you do these type of studies, you always have to replicate in additional cohorts. And we will do that in the next couple of years.